Hello, everybody. I would like to give you a short introduction on the clinical trials facilitation and coordination group's perspective on clinical trials in future. The Clinical Trial Facilitation and Coordination Group is a working group of the heads of medicines agencies and the European Regulatory Network of National Competent Authorities in charge of clinical trials. As you know, clinical trials are authorized and supervised by each concerned member state of the European Union, the national competent authorities and the ethics at the current and since 31st of January by the member state. So therefore, the Clinical Trial Facilitation Coordination Group, CTFG, you could say is a body for clinical trials. The goal is to harmonize and facilitate clinical trials in Europe, and it was started out with the implementation of the Directive 2001/20, and currently we sure work hard on the implementation of the Regulation 536/2014 and the implemented Regulation on Safety Cooperation. So we work for regulatory, scientific, and operational topics, and produce common opinions, processes, position, recommendations, and guidances. To give you a flavor what we have done so far as an output, we developed and tested and did a lot of cooperation for clinical trial application approval and substantial modification approval. You may be familiar with the voluntary harmonization procedure, also including ethics, the VHP+. We also developed a process to cooperate in surveillance of clinical trial and assessment of safety. We started out with annual safety reports, introduced SAMS concept, and lately we developed a procedure for SUSA cooperation. We also did quite a bit on positions, recommendations, papers, which we posted our website. I think the first large one was a recommendation paper on contraception and pregnancy testing in clinical trials. We had a set of question and answer documents on safety issues like the DSUR, the reference safety information. We drew up the evolution in clinical trials with recommendations to initiate and conduct complex clinical trials. We work on best practice, how you could best transfer a clinical trial which is ongoing from the directive to the regulation, what we would require, what is needed, how to act, how to plan it. Currently, the latest document is the question and answer document on in vitro diagnostic regulation and clinical trial regulation. This we have done jointly together with the medical device group of the Commission. It is adopted in the last plenary meeting. It has to be published, so that's ongoing and will come out soon. Further, we look on evolution in clinical trials and try what needs to be addressed or to harmonize throughout the countries, like digitalization or other new methodologies. We also have a lot of cooperation in our network with the Commission and with EMA working groups. You may have seen that the question and answer on regulation, like the safety section, is not totally different from what we have from the CTFG posted. We worked on this. We also supported the implemented regulation, recommendations on the auxiliary medical products, how to deal with them, and what could be done to really keep clinical trials ongoing also in our pandemic situation we are in. We give advice to the guidance on first-in-human and early clinical trials, and we developed a couple of best practices for internal use to cooperate, common understanding, especially now with the clinical trial regulation, which just started to be applicable because the CTs was going live on the 31st of January. So, as I said, the clinical trial regulation applies since 31st January 2022. This should be a big, huge improvement for youth sponsors, because it's only now one dossier required. You submit it once and you get back one decision per member state, not two, only one per member state. It is jointly from the NCA and the ethics. To make this happen, the CTs tool, the IT tool was developed. So it's one submission to all at the same time. you want to perform your studies in countries. It is a communication and decision hook between you sponsors and us member states. It is also a communication tool for safety issues when they may arise. So watch out for the ad hoc report. If you get a request for further information in the so-called ad hoc report, please take care, because it has an impact on your ongoing trial. It is also a tool to cooperate between the member states, not within a member state, but between the member states. And also I would like to make you aware that we still have 1 year of a transition in which you can decide to either submit within the regulation or to submit still within the old directive legal framework. But after 3 years, so latest early 2025, all ongoing clinical trials have to be submitted and transferred to this CTIS and clinical trial regulation framework, otherwise the authorization expires. Something else has happened. As you may be aware, there was a publication by EMA that they have formed an Accelerate Clinical Trials Europe initiative and founded a large coordination and steering group where Commission, HMA, and EMA are jointly steering the innovation in clinical trials within the network strategy 2025 and the pharmaceutical strategy. For detailed information, I would like to refer you to EMA's website. They get a little bit more out of it, but I think the goal here is to really foster clinical trials in Europe and research in Europe. And at the same time, when the regulation started at the 31st of January, the clinical trial facilitation and coordination group stopped working, or was stopping officially, and there's a transition now to a clinical trial coordination group. So what is the fact? The fact is there's a name change, and there will be a new mandate for the clinical trial coordination and facilitation group with new rules of procedure. Actually, the CTFG was asking for this to move more towards a legal body and to be more integrated in the network. So we have had out a call for new members to be there, and there will be a selection of chair and vice chair mid of February. Currently, there is formed a transition steering group, also together with HMA, CTFG members, EMA Commission, to define a work plan for the first 2 years. That should be done by April. And to tell you the truth, during this transition, the CTFG will work as usual, so business as usual. We will support and exchange, and then slowly transfer everything to this CTC group. So this is a big opportunity. So the big opportunity to enhance clinical trials future in Europe and to strengthen the network, to make it also easier for you when you're approaching the regulatory bodies. To give you a short outlook on this mandate, it is now mentioned that it's really an increased cooperation with relevant working groups in the regulatory network in Europe. So with Commission and HMA and EMA working groups. Currently, we have ongoing joint working on complex clinical trials question and answer update. This is jointly done the CTFG together with EMA and Commission. We also have another big group working on recommendation on decentralized clinical trials. This is done jointly with ethics committees from the CTEC group, the clinical trial expert group from the Commission, as well as the GCP inspectors working group. It's a bit slower than expected, also impacted by the situation we are in currently with the pandemic situation, but I think there will be some outcome this year. And I think this is also the opportunity with a new mandate to new cooperation, maybe even being observer in working groups. We still have also interaction with other working groups currently, but this will really facilitate the work we are doing. And also interesting for you, there's a task in the mandate to coordinate a one-stop shop for questions related to clinical trials, so that we really have one opinion in Europe, and it's it's done jointly together. The question is, how will it look like? This has to be determined. This has to be also figured out. You all know that we have currently an initiative already since a couple of few years, this inner steering group, where we have 4 groups in the innovation networks, the CTFG, the HTA, EMA with ITF and Scientific Advice Working Party. Our first task really was to draw up the landscape of support for sponsors from the beginning, the thought, the planning, the research, clinical trials, up to marketing authorization and life cycle management. So, and that may be a good opportunity to really foster these interactions and to think about a good cooperation, to feed back to you, just approaching one and not a couple of groups and get lost. So this work is ongoing, and I think it will be intensified, but it's still open and has to be defined as explained. Further, sure, we will further look for evolution in clinical trials. There needs to be evolution, horizon scanning, new methodologies, also risk mitigation in clinical trials. This we have done all the years, we will do in future. And also we will further work on our harmonization and coordination to implement the regulation. I'm pretty sure we need more best practices, more common documents of common understanding. We will further support the CTIS development and future vigilance where needed. And a big work will be at the safety surveillance, the cooperation for assessment of reports. And we can go back and focus again on training, which is a little bit down during the COVID time, but we will restart this. So talked a lot on what we have achieved, what we are aiming on. I think it's good to have now the CTCG integrated in the regulatory network to foster the forces for clinical trials, to support you wherever we can, and to facilitate clinical trials and research and trials in Europe. Thank you. Open for questions.